In the last 30 minutes, the White House says the Centers for Disease Control will recommend that all Americans cover their faces when they go outside. It will not be mandatory. So we wanted to know, what are doctors saying about the value in all this? Kayla Green joins us now live from Rochester General Hospital with more on that. Kayla.
Adam, the doctor I talked to today says everyone wearing a mask couldn't hurt, but social distancing is still the best way to protect yourself from getting the virus. He also says if you are choosing to wear a mask, make sure you're continuing to take all those necessary precautions to protect yourself.
I think it's fair to say the masks couldn't hurt unless they gave you a false sense of security.
That message from the governor today is exactly what Dr. Emma Lesho is saying about the question of masking in public.
A mask out in the public open space has very limited value. So and the reason why hospitals have gone to universal masking is because healthcare workers cannot abide by the 6-foot rule. You know, we have to get close to patients to treat them, to examine them.
Dr. Lesho says he's worried about masks running out for healthcare workers.
We have to do the best we can to be good stewards of the limited supplies that we have so that the healthcare workers who are at the highest risk can make sure that they can protect themselves safely.
So what qualifies as a mask?
When a doctor talks about a mask, they're talking about a form-fitting mask that goes around your nose that doesn't allow any other air to come in. That's really what a mask is. So to ask a doctor, does a bandana help?
Theoretically, a lot of things might help, right? So bandanas, better than nothing. In a supermarket where most people are not coughing a lot and stuff like that, probably homemade masks are quite useful.
So doctors are warning to not have a false sense of security when you're wearing a mask. And what they mean is to make sure that you're still taking those other precautions. So if you touch a contaminated surface and then touch your face, that is still a high risk to contract COVID-19. Live in Rochester, Kayla Green, News 8.
Kayla, thank you. Great information as always.